Signs of a stroke 1 week in advance. Potential risk or warnings of immediate danger may include headaches, dizziness, and numbness in the limbs. Early recognition of the risk through signs of a stroke 1 week in advance helps each person be more proactive in handling the situation. Common signs of stroke 1 week before. Stroke symptoms often occur in an urgent manner, meaning that a stroke can occur quickly after abnormal signs appear. However, in some cases, the patient may have warning signs of stroke risk before, usually due to transient ischemic attack or rupture of small blood vessels in the brain, mild level. Below are early warning signs that patients should not ignore. 1. Numbness or weakness in one arm or leg. Numbness and weakness in one arm or leg are considered early signs of stroke, which can occur a week or more before a stroke occurs, when the brain is deprived of oxygen and blood. Difficulty moving the limbs can also be associated with the risk of nerve damage or cerebrovascular disease. Patients should see a doctor early for timely diagnosis and treatment. 2. Dizziness, impaired vision, sudden vision loss in one or both eyes, including blurred vision. Dizziness should also be considered as one of the signs 1 week before a stroke, or longer or less time. This condition occurs due to reduced blood flow to the brain, affecting the visual area. This warning symptom needs to be examined promptly to avoid serious complications. 3. Dizziness, loss of balance. If you suddenly feel dizzy, lose your balance, become unsteady, or can't stand, seek medical attention immediately. This could be a warning sign of a stroke or transient ischemic attack. This condition indicates that the area of the brain that controls balance is affected. 4. Severe headache of unknown cause. Headache is a common symptom of many diseases. However, if the pain appears suddenly, is severe, has no clear cause and is not relieved by using common pain relievers, it should be considered a sign of a stroke, which can occur 1 week or many days before. Signs of a stroke 1 week before. The cause is due to the area of the brain related to pain sensation being affected by a stroke. The headache is often widespread, prolonged, and may be accompanied by symptoms such as numbness in the limbs, crooked mouth, difficulty speaking, or impaired consciousness. 5. Voice disorder, difficulty speaking, difficulty understanding what others say. The cause is due to damage to the area of the brain that controls language, causing impairment or loss of function, leading to the following condition: stuttering, difficulty speaking, or loss of ability to speak, not understanding or responding slowly to what others say, confusion, forgetting words, difficulty expressing oneself. This is also a typical symptom of a transient ischemic attack, TIA, which indicates a temporary reduction in blood flow to the brain. Patients need to be monitored and receive timely medical intervention to reduce the risk of stroke. 6. Memory disorders, short-term memory loss. Memory loss or confusion in daily life can be a sign to watch out for, especially in the elderly. In some cases, temporary memory loss is one of the early warning signs of a stroke. The cause comes from a decrease in blood flow to the areas of the brain that control memory, causing the patient to forget information, have difficulty remembering names of acquaintances or places, and easily get confused about time and space. 7. Changes in mood and behavior. The patient becomes irritable, anxious, depressed, or has behavioral changes for no apparent reason. These manifestations may be related to physiological or psychological changes or side effects of medications. 8. Movement disorders. If there is difficulty performing movements such as writing, buttoning a shirt, or coordinating the hands and feet, accompanied by a feeling of prolonged fatigue, it can also be considered a sign of a stroke, which can occur 1 week before, becoming a sign 1 week before a stroke. The cause is due to the brain not receiving enough oxygen and nutrients, leading to a decline in neurological function. The patient may experience symptoms such as unexplained persistent fatigue, pale skin, lack of energy, loss of motivation to work, frequent drowsiness and decreased ability to concentrate. 9. Convulsions. Although rare, seizures can occur due to temporary disturbances in the brain's electrical activity, associated with transient ischemic attacks. This is also the result of a sudden reduction in blood flow to the brain, affecting neurological function for a short period of time. What to do when there are warning signs of a stroke 1 week in advance? As soon as you detect signs of suspected stroke such as crooked mouth, weak limbs, difficulty speaking or altered consciousness, regardless of time, call an ambulance immediately. Do not use any medication without a doctor's prescription, especially blood pressure lowering drugs and anticoagulants, to avoid affecting the treatment process. While waiting for emergency care, it is necessary to closely monitor the patient's health condition, observe changes in consciousness, movement and breathing. At the same time, it is necessary to stay calm and reassure the patient to avoid panic, help stabilize blood pressure and limit the risk of cardiovascular complications. 2. Who is at risk for stroke? People aged 55 and over. The risk of heart disease and stroke increases with age due to aging of the blood vessels and heart. People with high blood pressure, diabetes, and dyslipidemia. These diseases damage blood vessels, cause atherosclerosis, and increase the risk of blood clots. People with a history of cardiovascular disease, atrial fibrillation, cardiovascular diseases such as coronary artery disease, heart failure or atrial fibrillation increase the risk of blood clots forming, leading to stroke. Smokers and alcohol abusers. Smoking causes blood vessels to constrict, increasing the risk of atherosclerosis. Drinking too much alcohol can cause high blood pressure and heart rhythm disturbances. Obese, sedentary people. Being overweight causes metabolic disorders, increases blood pressure, blood sugar and blood fat. A sedentary lifestyle reduces blood circulation, increasing the risk of blood clots. People with a family history of stroke. Genetic factors can influence the risk of heart disease and stroke, especially if a family member has had a stroke or early heart disease. Stroke prevention measures. To maintain health and prevent related diseases including stroke, effective control and prevention measures need to be applied. Control blood pressure, blood sugar, and blood lipids to protect blood vessels and prevent cardiovascular complications and stroke. Maintain these indicators within safe limits as directed by your doctor. Eat a healthy diet rich in vegetables, fruits, whole grains, and low in salt, sugar, and saturated fat to help control blood pressure, blood sugar, and cholesterol. Maintain physical activity for at least 30 minutes a day with suitable exercises such as walking, swimming, cycling to improve cardiovascular health and control weight. Limit alcohol and do not smoke to reduce the risk of atherosclerosis, improve circulation and protect the lungs. Regular health checkups to monitor blood pressure, blood sugar, blood lipids and early detection of risk factors. Early stroke screening at Tam An General Hospital System. Tam An General Hospital System provides stroke screening and treatment services with modern equipment and a team of experienced experts. The screening packages are scientifically and comprehensively designed, examining the entire body in detail, detecting all risks. Applying advanced techniques such as advanced testing systems, high-end ultrasound machines, 3 Tesla MRI, 768 slice CT, 1975 slice CT, 100,000 slice CT, digital subtraction angiography DSA, helps to detect early risks such as vascular stenosis, atherosclerosis and arrhythmia. In emergency stroke treatment, the hospital deploys advanced methods such as using thrombolytic drugs, endovascular intervention to remove blood clots, and AI robotic surgery to remove blood clots. The application of technology helps increase accuracy, reduce risks, and improve treatment effectiveness. Regular screening and access to modern treatment methods at Tam An General Hospital help prevent stroke effectively, protect long-term health and improve quality of life. Please contact Tam An General Hospital System via the information below for consultation and appointment for neurological diseases. Recognizing the signs of a stroke 1 week or earlier, more urgently, always plays an important role, helping patients proactively go to the doctor, prevent risks and protect their health. If there are symptoms such as numbness in the limbs, dizziness, headache, memory loss or difficulty speaking, the patient needs to be taken to the doctor immediately. Signs of a stroke 1 week or longer in advance may not be obvious but need to be noticed to proactively handle, avoid subjectively ignoring.
Thank you, gentlemen and ladies, for taking the time to watch today's video. Maintaining health in older age is an important journey that requires special care and attention. I hope the information and advice I shared will provide you with useful knowledge to maintain your health, live joyfully, and enjoy the golden years of your life. Once again, I sincerely thank you for your attention. Wishing you all good health and happiness. Please subscribe to the channel to motivate me to create more informative videos on health care. See you in the next videos.